Hello everyone, I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be talking about how to manage weight gain in cancer patients. So generally we come across patients who will experience a weight loss, but however it can also be the opposite in certain cases as well. Generally, weight gain is seen in the patients who are undergoing hormonal based therapies, and this is commonly seen in breast cancer patients as well. However, uh, weight gain can also be seen in patients who are on steroidal drugs because they tend to have a more enhanced appetite. Why? Because steroids are known to also be an appetite stimulant as well, and it could also be because of fluid retention in the body. But however, we will be speaking about fluid retention and how to manage it in cancer patients in the further videos. Now it is very important to understand how to manage weight gain in these patients. So we generally, yes, nutritional assessment is also important because we need to also understand that what is their nutritional status, which will also help us understand what is the modality of approach when it comes to the dietary restrictions as well. So we not only see the BMI, which is the body mass index, it is also important to see and measure their waist circumference and hip circumference to understand how much is it and are they at a risk for any other comorbidities as well. Ideal body weight has to be calculated based on their height, all right, and it is also very important to understand what is their current weight and what was their weight 3 months back, and we need to also understand in a span of how many months has this weight increased. It is crucial to also understand what medications are they taking, what kind of a treatment are they undergoing. Is it chemotherapy or is it because of any other drugs like steroidal medications as well, because it is very important to understand what could be a cause of weight gain in these patients. Now we will go ahead and understand what are the important dietary guidelines to take care of in these patients. First of all, you need to ensure to eat fruits and vegetables which are seasonal in your diet, and also to incorporate complex carbohydrates like millets or even brown rice in the diet. These have fiber in them, which is also going to help in giving us a feeling of fullness, or what we call as satiety to us, because it will ensure that we do not have eat a large meal at one go. Next, you need to also pay attention to your portion sizes as well, right? Quantity is also very important, and the portion size in the diet is also very important. So serving size of a food is what is important as well. Next is whatever food you eat, it could be even homemade food, it's very important to love what you're eating. So this is basically what I call as mindful eating. So when I say mindful eating, you need to sit in a calm environment to eat your food, and you need to love what you're eating, because you need to say yourself that yes, the food what I eat is also going to be nourishing for my overall health as well. Okay, eat when you're hungry and stop whenever you're feeling full. Do not try to overeat. Our stomach is also going to give us a signal, or our mind is also going to give us a signal that okay, I am full and you can't eat. It is very important to engage in a regular physical activity. So you can always get in touch with your oncologist or a doctor who is going to guide you as to what is the beneficial exercises which can be done at your home as well. So everyone, to conclude, yes, it is also very important to manage weight during and even after the treatment, which is going to also help in reducing the risk of various comorbid conditions also. Eating a well balanced diet, moderation is also the key, and engaging in regular physical activity are very important for managing your weight. Thank you so much for watching my video. In case we at ZenOnco.io are here to navigate you through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number.